Vaginitis is a lot more complicated topic than it used to be. It's basically what amounts to, if you want to call it, irritation, inflammation of the vagina. From the standpoint of age, there is a difference. You can see it all the way from children to menopausal women. It's probably more frequent in the reproductive years. I saw a thing recently that said 1 out of every 3 reproductive age women will run into some vaginitis issues. Symptoms can be quite wide range. Sometimes just flat out irritation, itching, burning, foul smelling discharge, increased discharge. There can even be sometimes bloody discharge. There can be, one of the more common is symptoms that overlap with bladder infections, pain with urination, urgency, frequency of urination. Before I went to medical school, I got a degree in microbiology, and I was trained as a scientist first and then a physician. The significance of that, I think, is that as a scientist you ask why, as opposed to some of the algorithms we're taught in medical school. I mean, algorithms are good because you don't miss things by adhering to them, but it never allows you to ask why. Probably the biggest culprit, bar none, is overuse of antibiotics in our world. And it doesn't make any difference which age group, but it disrupts the normal flora. In particular, one particular bacteria gets killed off very easily. It's probably the most important one in all of our systems, whether male, female, old, young, and it's a bacteria called a lactobacillus. All humans are supposed to have that. But as I tell patients, it's also the wimpiest bacteria. And so you get antibiotics, and it's one of the first organisms to go. I can tell you about a 6-year-old girl that I saw that social services said should be seen because they're sure there must be some sort of abuse going on, because she'd go to school, she'd wet her pants. She always had to go to the bathroom. She was always fidgeting with her underwear and stuff like that. And so I saw this youngster, and there was no evidence of abuse other than the medical profession. Went through her chart, and from the time she was born till the time I saw her, there was 6 months of her whole life when she was not on antibiotics. So in a sense, she had nothing normal in her system. The environment of the vagina, her GI tract, everything was totally disrupted. And all she had basically was probably organisms that were becoming resistant to everything.